Hey, Dr. Kay.
Hi. Nice seeing you.
You too. Hello, my name is Angela Spinella. I'm the manager of Outpatient Pediatric Services.
And I'm Steve Kanengiser, Director of Pediatric Pulmonology at Valley Medical Group.
Many of our patients have a lot of questions for Dr. Kanengiser regarding pediatric pulmonary. So our first question is, who should see a pediatric pulmonologist?
So breathing issues are one of the most common medical problems that your child may have. And it can range from a simple cold with a cough to recurrent or severe respiratory problems, sometimes coming on suddenly in the middle of the night, like croup. And that can be quite frightening and scary. I remember my first child and my wife's reaction to that. So I get it, and we work with that. Sometimes it's a simple viral illness that is a one-off episode. Other times your child may develop recurrent respiratory problems, and that may be a key that there's something more serious going on. And unlike, let's say a broken bone, which is fairly straightforward to diagnose, respiratory problems can sometimes be a little tricky. And a pediatric pulmonologist is going to take a very careful history, looking at patterns of respiratory problems, as well as other associated issues that may often allow them to diagnose what's going on, in one visit.
That's great. So what pulmonary or respiratory issues do you treat?
I treat a wide variety of essentially all pediatric breathing issues. By far the most common is asthma, which is highly controllable. My goal with managing any child with asthma is to allow them to participate fully in any activity that they want, be it sports, dance, whatever, so they can participate fully without fear or limitation.
That's great. So what do you do for asthma that a pediatrician cannot do? So how would our parents know when to go to you versus when to go to pediatrician?
Sure, the pediatricians do an amazing job. They treat all medical conditions and even a lot of psychosocial conditions. But I'm all about the lungs and breathing. And in our division, I work with a certified respiratory therapist who's also a certified asthma educator, and we're able to do breathing tests on most children 5 years old and up. And that allows us to both diagnose and manage a variety of different respiratory problems. And we really emphasize patient and family education so we can work together to make sure the child gets the care and management that they need.
That's great. So parents will ask, what is special about our pediatric pulmonary program at Valley Medical Group?
I have to say first that we love kids and we try and make the visit as fun as possible, whether we play games during the exam and joke around, or when they do their breathing tests, we have age-appropriate video games. So the child will really give their maximal effort when they're blowing hard, which we need for the test. And that can be blowing out candles on a birthday cake or blowing a bowling ball down the lane to knock down pins.
What causes some pulmonary issues in kids, just generally?
Well, the most common trigger for respiratory problems, regardless of underlying condition, are going to be colds and viruses. And obviously children have lots of those, but when they're having recurrent problems with simple colds or lingering symptoms after colds and viruses, that may be a sign that there's something more going on.
Well, I thank you so much for your time today. I think this is going to really help a lot of our patients and our parents at home. If you want some more information, you can call our offices, and thank you so much.